Welcome to HealthData Talks, where industry experts offer bite-sized tips and trends for managing legacy data.
Thanks for joining us. I'm Shannon Larkin with Harmony Healthcare IT, and today I'm talking to Dave Navarro, who's the Senior Director of Data Science for Harmony. Welcome back to the program, Dave.
Thanks, Shannon.
So at Harmony, we're managing data for healthcare organizations. Most of the time, that means we're extracting and migrating and retaining records. But with the 21st Century Cures Act, we're now preparing our customers for this push for greater interoperability, especially with regard to their archive data. So I thought today, Dave, we could just kind of run through a high-level overview of the Cures Act, what it means for providers, and then specifically how it impacts their historical records that are archived. So to get started, could you just kind of introduce yourself and let us know what you're doing at Harmony?
Sure, Shannon. I am the Senior Director of Data Science here at Harmony. I also am working with all of our interoperability efforts, specifically those that pertain to the 21st Century Cures Act, working with all the integration methods and health information exchange methods that we're building here at Harmony.
Great. So let's just dig into the Cures Act then. Why don't you explain information blocking and why that might be important?
Sure. In our world, when we talk about the Cures Act, most people are focused on the information blocking provision of the Cures Act, which really the goal of the information blocking rule inside of the Cures Act was really to focus on the enablement of patient access to their own medical records. And the Cures Act does that in a couple of different ways, either through Certified Health IT program, which makes sure that health IT meets a certain standard for security and interoperability. And it also uses something that we call the information blocking rule, which really its intent is to make patient records easier to access and really defines what information blocking is. So if we look at the definition that the ONC has for information blocking, it's any practice that interferes or prevents or discourages the exchange or use of a patient's electronic health information. And it's really important because we're really trying, the 21st Century Cures Act really has a focus to getting the information into the hands of the patient. Better informed patients really lead to better outcomes.
Sure. So I would imagine the information blocking rule applies to providers. Who all does it impact in the health ecosystem?
You're correct. The ONC has categorized who the information blocking rule applies to based upon what they call actors. The first is health information exchanges or health information networks. The second is certified health IT vendors. And lastly, as you mentioned, Shannon, it really applies to healthcare providers, which is really where our concern is and our focus is really helping our providers with compliance in the information blocking area.
Right. So with regard to compliance, what is the consequence if there are providers who aren't ready for this provision? What happens?
Sure. First, I'd like to talk about how an information blocking claim is submitted. So anybody can do this right now today. The ONC has a website. If you Google ONC information blocking portal, you'll come up with a form. You can fill out the form anonymously, or you can put your first name, last name, and email address and the description of the information blocking claim. So it's pretty easy for people to make an information blocking claim today. And right now, the penalties are pretty clearly spelled out. For certified health IT vendors, you may be looking up to $1 million per violation. Health information exchanges, up to $1 million per violation. And providers, it's a little bit less, and that rule is pending, but you're still looking at tens of thousands of dollars in penalties if you're a provider and you're not sharing information and you're participating in information blocking.
Yeah, definitely worth having a plan then. Interesting on how you're reporting the claims. Have a lot of those been filed already? I haven't gone to that website to take a look.
Yeah, if you go to that website, there's some statistics that are out there. So far, there's been about 600 valid claims of information blocking, and 499 of those complaints were categorized of people complaining against that providers were participating in information blocking. So the number out there already is pretty significant.
Got it. Okay, so then we should move to how at least we're enabling our clients to comply with 21st Century Cures Act. So you've got records that are active and in your active EHR, and then you've got records that might be stored in your archive. I guess my first question is, what information is required to be shared with a patient when they make a request?
That's a good question. And part of the confusion right now lies within that question, Shannon. So I see the information blocking that was really applied under the 21st Century Cures Act. It was applied in two phases. The first phase began in April of 2021 and ran all the way to October of 2022, where the type of information and the actual classes of information and data elements that need to be shared, they were pretty clearly defined based upon the specification called the USCDI, or United States Core Data for Interoperability. So it was a set list of data elements that you needed to exchange in order to be compliant with the information blocking rule. Now, October the 6th of 2022 is where the content standard changed. Instead of the content being related specifically to data elements in the USCDI, content was changed to you must share all patient EHI. Anything that was utilized to take care of the patient should be shared with the patient.
Okay, so then for hospitals that have an archiving strategy in place where they're storing historical records separate from their active EHR, how do they marry those records for the final fulfillment on the release?
So when we're talking to our customers, the first thing is we want to do is we want to talk strategy. What is your plan for sharing data and what are you going to share? We suggest if they haven't already met with their internal team on defining what their HIPAA designated record set is to define what data elements you are. Maybe you start with the USCDI version 3, which is the latest version, and then you add to that and really make it compliant with your internal HIPAA designated record set, because you got to have a body of data and rules of what you want to share externally. The next thing we do is we meet with them on and discuss our ROI process inside of our HealthData Archiver. The ROI process, we put in a method called secure record delivery, which takes the data that's defined in the ROI process and we're able to electronically send it over to a secure endpoint that our customer wants us to send it to. That can be an EHR, where then it can be picked up by the EHR ROI process, or it can be off to a secure patient portal where the patient has access to their historical records via the portal.
That sounds great. So are a lot of, I would imagine you're just having conversations every day about this then with customers so they can start to prepare and be ready to do this.
Yeah, absolutely. And they're pretty excited about it because it's a low-level entry to do something really big. So when you take a look at leveraging the ROI processes that are already in place, whether it's in the HealthData Archiver or the EHR system, if you leverage those processes in order to access the historical record or make that historical record available to the patients, it's a low-level entry which provides a lot of benefit when you're looking at those penalties that are imposed by the 21st Century Cures Act.
Right. And none of us want penalties. We want solutions. So thank you very much for all of the work you're doing on that. It sounds like a great pathway for compliance. And thanks for the overview on the Cures Act. Anything you want to add or actions that anyone should take to get a hold of us to learn more about this solution?
Yeah, first thing is be aware. There was a big concern on October 6th of 2022 and excitement of how I get that data to the patient. There should still be excitement. There's monetary penalties out there. So come up with a strategy and make sure that you're defining what your HIPAA designated record set is, that it's including data from the archive, because again, anything that's used to treat the patient really should be available to the patient. So I would encourage having those conversations internally and then also reaching out to Harmony Health IT for our guidance on how we're electronically sharing the historical record.
That makes sense. I think every patient deserves a copy of their full clinical narrative. So thanks so much, Dave, for joining us today.
Thank you, Shannon.
And to our audience, thanks for tuning in. Be sure to join us next time for a meaningful discussion around the management and interoperability of health data.
That's it for this session of HealthData Talks. Check out helpful resources at harmonyhit.com and follow us in your favorite podcast app to catch future episodes. We'll see you next time.